The recording. All right, well, welcome everybody. We are so excited to come to you guys. This is week 3 if you've been following along in the series. And we are excited about the 2nd and 3rd trimester. If you are in this trimester, you know that there's a lot going on and a lot that you might need some help with. So we're super excited to get started with the content. Reminder, this is recorded and we will post the link in the event page. If you can't find that link for some reason, just reach out to Natural Nurse Robin, that's me, Robin Stetzel, or Kristen Spangler, and we will get you that link. Remember also that we are going to be doing amazing giveaways at the end of this series. So for those who are registered for the entire series, we are going to be giving some giveaways. So excited for all those people that have been registering and watching it. Get a pen and paper if you haven't already. You're going to want to take some notes, making your wish list, all of those things, so that we can make sure that you are not feeling overwhelmed with the information that we are about to go through. Before we get into all the good stuff, we will just introduce ourselves. We do this every beginning of the series because we're not sure who's jumping in where. So my name is Robin Stetzel. I am a holistic nurse. I am also a certified aromatherapist, and I am a gold leader in Young Living. We are a part of a global team called the Vibrant Drops, and we have over 1,500 members on our team. And many of you are probably on our team, and we are just dedicated to giving information and education so that you can become an advocate for your own health and your family's health. I got started in holistic nursing when my son was having some issues at 3 years old, and he is now 14 and totally healthy. But he had a lot of issues with his skin. He had an autoimmune disease. He had other sensory things going on. And I truly believe it had everything to do with my pregnancy and what happened during the birth process, that I didn't know the information I needed at the time to make the choices that you guys are getting with this. So we did a lot of the things that we talk about. We removed toxic chemicals. We cleaned up his diet. And after a year of doing the things that we are about to teach you tonight, he lost those diagnoses. One of the main reasons why I decided to leave my nursing career in the hospital and focus on educating people on natural approaches, and prevention is key. Again, I'm so blessed to be able to share this talk with Kristen Spangler, who is a childbirth educator. And Kristen's on with us. Will you tell us a little bit about how you got started on this journey?
Yes, so like Robin said, my name is Kristen Spangler. We are a family of 5, so I have 3 kids aged 7, 4, and 18 months. I've been with Young Living for almost 5 years now, and I am also a certified childbirth educator. So when my oldest, who is now 7, was born, I just became really interested in birth and breastfeeding and pregnancy and all of the stuff that surrounded that. So I actually got certified to become a doula, which was great. But my oldest had a lot of just health challenges. He was a higher needs baby, nursed all the time, didn't ever want to be, I could only really be the only one staying with him because he wouldn't take a bottle. And so on-call birth work was not working well for our family. So I channeled that, and then I became a childbirth educator with a company called Birth Boot Camp. So if you haven't heard of them, they're out of Texas. They focus all on the natural side. They want to support, arm couples with just all of the knowledge so that they can make the best choices, which I love that I can tie both of those together, because I feel like Young Living is kind of the same. We as Young Living educators are pulling together all of this information to share with people because that's our passion. And it allows people to really have, to make the choice to live their best life. So I had asked Robin to do this with me so that we could focus on, with her background as a natural nurse and mine as a childbirth educator, I really wanted to just pull together all of this information so that women who are, you know, thinking about becoming pregnant, are already pregnant, even if it's not your first baby, or even, excuse me, even if you are listening to this and you're not pregnant, but you have family members that are pregnant, you can use this information to pass on. And so I've been a childbirth educator for almost 5 years now. Well, 4.5 years. I got certified when my middle daughter, right after she was born in 2014. And I have been teaching ever since. And I got involved with Young Living when my oldest was just having some issues that we wanted to take a more natural approach, but I didn't really know what that was. My husband's a chiropractor, so of course we were doing that. And, you know, we had our feet wet in that water a little bit, but he was also a new chiropractor, so we really didn't know. And then I was introduced to Young Living and thought, oh my gosh, this is so great because everything is at my fingertips and it was effective. And that's really what stuck with me.
Awesome. And I just love that Chris and I have partnered together just because, we have such like-minded passions for just sharing what we do. So super excited. And thank you so much for asking me to do this with you, Kristen.
Of course.
That being said, I always have to throw this disclaimer out there. So I am a nurse. We are not doctors. Yes, she's an amazing childbirth educator, but we want to make sure that you guys understand that we are not physicians, and this information is shared in this talk is just for educational purposes only, just to empower you guys to really dive in and do the education that you need to empower yourselves and your family to make the choices that you feel are important for your health. So we are not here to diagnose, to mitigate, or cure any health condition. And obviously we always have to say to please seek appropriate medical attention when necessary. So just give us a little recap here on, the importance of what we're about to talk about and everything that can come along with pregnancy and childbirth.
Yeah. So for people who have been on, Rob and I were just talking that we feel like it's been longer than 3 weeks, which we did a full, like an introductory class that led us into this 3-week series. This 6-week series, this is week 3 of 6. So some of this stuff you guys might be like, wait, I heard that, I know that, or that slide looks familiar, because it really is going to be appropriate for each week that we're focusing on. So, being pregnant and expecting a child is, a lot of women, they look forward to that. They can't wait. For some women, it's a surprise. And then they're like, oh my gosh, what is going on? It's always a time, or it's usually, a time of rejoicing, a lot of planning for most women. Some women that I know, they're like, yeah, I'm just, they're not really into planning it. And I think it should, we take so much time to plan weddings, and the birth of your child and kind of how you're going to transition into parenthood should be equally as important.
I agree.
But, this is also a time when, when moms are pregnant, sometimes a switch just flips and they all of a sudden become a little bit more aware of, more natural options, and thinking like, well, maybe those conventional remedies and therapies for common occurrences might not be the best choice because of complications or side effects. So this makes looking at natural products more of a priority. So at this point in pregnancy, you might be experiencing, we're talking 2nd, 3rd trimester here, you might be experiencing heartburn, interrupted sleep, restless legs, or even cramps. And you need to focus on how to keep your immune system strong. Yes, all of those can be done, with medication in the traditional, like the Western medicine, American medicine model. But this is a time when a lot of soon-to-be moms take a closer look at the range of chemicals used in their homes and on their bodies, and just to treat and support their bodies during those times. And they're researching those more natural options. When I am working with parents and clients in my birth business and with Young Living too, I've actually feel like I cross over. I have a lot of parents that are new parents or expecting parents, and they're also interested in oils. And so I kind of can bring that together. And a lot of them, I feel like it brings them to that path because they are like, oh my gosh, Google is so overwhelming. Even when I go to Target or, Babies R Us, there's a billion options. Some of them say natural, but they're not really natural. I don't know what to do. And so I think that they really just want to know where to go, what to buy, what is going to be most effective, what's going to give them the most bang for their buck, and just have direction in that way so that it feels less overwhelming. And that really is mine and Robin's goal. That's my goal as a childbirth educator, so that people feel, confident and prepared for their birth. And also when I'm working, with young living people, and I know Robin is the same.
Yeah, for sure. And again, we always talk about this too, the importance of reducing chemical exposures, even, well before you even become pregnant. It's so important. And we take for granted, or maybe we don't even realize what the outcome can be if we don't address these. I feel that, well, actually, I know, because we did his blood work at 3 years old, I know that the things that I was exposing my son to while he was in utero had everything to do with his autoimmune issues and just really how his immune system was set up just right when he was born. So I had no idea, you guys, as an oncology nurse, I know about chemicals. I know that toxic chemicals can cause cancer, but I had no idea the impact that the lotions and the hairspray and, my wallflower plugins and all of that. I had no idea that it was impacting my son's immune system while he's growing inside me. And so we know now that the average adult is exposed to more than 700,000, you guys, 700,000 different toxic chemicals on a daily basis. And those chemicals are not only coming from our skincare, but they're coming from our food, our water, the air we breathe in, the clothes we wear. We know that when we first have our newborn baby or when we have the baby shower, right, the first thing, what do? Is, we have to wash all the clothes because we know there's flame retardants on there. Or maybe you didn't know that. But, some moms, they know this and they're very concerned with washing the clothes and getting those chemicals off. But then they don't realize that maybe what they're washing their clothes in, like Dreft, contains even worse chemicals that maybe were on the clothes in the first place. And what we know now is that the umbilical cords have been tested of newborns, and the Environmental Working Group did a study, and if you can find the study on ewg.org. They did a study where they were testing newborns' umbilical cord blood, and they found 287 chemicals on average just from the blood right when they were born. And of that, 180 of them were known to cause cancer, and 217 were toxic to the brain, to the nervous system. 208, you guys, caused birth defects and known to cause birth defects. So we know that these chemicals can play a huge impact on starting off the immune system of our newborn babies, and why it's so important to know you don't have to go live in a bubble, but you do have to be very conscious about what you're putting not only in your body, but on your skin and in your home as well. So toxic cleaners. Our indoor air now is, the EPA estimates that it's up to 10 to 15 times more toxic than our outdoor air because of the chemicals we're using to clean with. So I use Thieves Household Cleaner now, but man, I wish I would have known back then when I was pregnant with my son that, these chemicals that I was cleaning with could have a detrimental effect on him. So it's really important to know that if you change anything in your daily routine, let it be your household cleaning products, because that's going to be the biggest exposure that you have. And just knowing that, we have to just keep the body burden down. We think about our body as a bucket or a pond. So anytime we come in contact with these toxic chemicals, think about your body or your baby's body as a bucket, and this bucket fills up. Our immune system knows how to get rid of these to a certain extent, but when that bucket gets full, then the immune system in our body just can't keep up, and then it starts affecting our immune system, all of those different organ systems, and it can cause major problems. So keeping these at a minimum, if not eliminating them altogether, of course, is the best option. And can't stress this enough. I suggest people do a detox 6 months before they even become pregnant. You know, even just through it, you don't want to detox while you're pregnant, but you do want to make sure that you're eliminating those toxic chemicals from your daily lives. So the other thing that you can do, again, without feeling too overwhelmed, going, oh my gosh, I don't know if what I'm using is toxic, you can download a app on your phone, and it's called the Healthy Living app from Skinny Deep, or you can download the other one that's called Think Dirty. And with that, you can scan the products. You can see which ones are toxic. It'll give you a score of 0 to 10, 10 being the most toxic. And it'll tell you exactly which ones you want to start eliminating from your home. So it's a really cool app to get. I encourage everybody to start just eliminating those things that you start using on a daily basis and swapping them out for the green. You know, Young Living has an entire line of products. Now, most people know Young Living as an essential oil company, but they are a wellness company, and they have everything from skincare to makeup to baby care line to pet care line. Literally, you can shop from your home, ditch Target, and get the safest products right from your Young Living account. And that's what I do now. And man, I wish I knew about it back then, because my life would have been so much easier. But get this app if you don't already have it, and start eliminate those toxins.
I know that I have the app on my phone, and even now, even though, you know, I use Young Living and I don't question that because I've already researched it, sometimes just out of curiosity, you know, I'll find something at Target and it says natural or whatever it says, and I'll scan it and I'm like, really? You know, it comes, I love how that app breaks down the ingredients so that you know which ones are the most toxic, so that you can, you know, make it a point to avoid that. So that app is, and it's free. So definitely, if you're listening, make sure that you download that app. I actually was looking up, it's funny that you mentioned Dreft on here, because I was looking it up on the app, and it's not in the new updated app, but it was in the old one. And all of the ratings on there are anywhere from an 8 to a 10. Like, they're all red and yellow. And then there's, of course, alcohol, water. Those are all like a 3. But there's, there's 7 of the top ingredients in Dreft, which is, you know, the most recommended for babies, are either red or yellow. So
that's scary.
I mean, it's, yeah, definitely. Okay, so now when we talk about the oils and all of Young Living products, we want to start by talking about the quality. Not all oils, because in this whole series, we're talking about a toxin-free approach. So we're not just talking about essential oils, even though, like Robin said, that's what Young Living is known for. But we're also going to be talking about other targeted supplements that can really support you. So knowing that not all oils and supplements are created equal, and that quality definitely matters. So as moms, we definitely, I mean, of course, we want the very best for our kids and our family. That means that we want high quality products that are safe and effective. You know, before I found Young Living, we were buying high-end organic whole food supplements. And now I'm like, oh my gosh, it was worth the cost because I knew we were putting good things in our body, but you want them to be cost effective, you want them to be safe, and you want them to actually work. So when we talk about Young Living's quality and standards, for those of you who don't know them, Young Living has a seed to seal guarantee and promise. So what that means is that the company abides by very strict guidelines to fulfill this promise to us as consumers. Young Living owns its own farms, which no other major company does. It has partner farms that have to abide by the same standards as well. Young Living picks the absolute best seeds from strong and thriving plants. This was something I just learned within the last year, because I've been more and more interested in the production and the farming side when I'm teaching others about Young Living. Young Living actually hand weeds and uses its own oils on plants for pest control. This allows them to avoid healthy chemicals on their crops. They harvest at peak times. Young Living distills all their oils on site without any chemicals. They test every batch multiple times throughout the process with state-of-the-art equipment. All of these factors make a huge difference in the quality and effectiveness. If a batch doesn't meet the standards for any reason, it doesn't get bottled up to distribute. Young Living would rather something go out of stock, which does happen, than let an inferior product slip through to us, which I know it's rare to find a company with such high standards. And another amazing thing about Young Living is that you know, for people who are really spending their time researching all of these companies, you want a company to be transparent, right? That you can't believe everything that you read on the internet. Any person, you know, a member, a leader, a non-member can go to a Young Living farm and see all of this being done right before their eyes. They have nothing to hide. So you can go there and you can watch all of this and you can see for yourself that they truly are committing to that seed to seal commitment for us as consumers.
Yeah, definitely. And, you know, when I was researching essential oil companies, deciding which ones I wanted in my practice for my patients, since I'm an aromatherapist, by far, you know, there was no other comparison than you know, to Young Living. So when we talk about switching and ditching the toxic chemicals, again, some of those big players I just talked about, you want to switch out your cleaning products. And even if it says green, you guys, I used to use Myers, Myers. And even if it's natural and organic and green, you really have to look at those ingredients because marketing is out there and you just don't know. So switching out the laundry soaps to your cleaning products, making sure that what you're putting on your skin every single day is the cleanest possible. The mineral makeup, you know, we have an entire line of makeup. Those things, they get through our skin. Anything we put on our skin within 26 seconds, you guys, it is in the bloodstream. Within 20 minutes, it's affecting your organ system. So you got to make sure that you are using the cleanest products possible. So we are going to be diving right in and talking about the second and third trimester and what is out there for you guys to survive through these.
Definitely. So, I mean, each of these modules has been super exciting to dive in deeper. I feel like even as, you know, a childbirth educator, I'm in a lot of crunchy moms groups and birth specialist groups and birth worker groups. I've even learned more things about ways that I can support my clients through, you know, researching and preparing for this workshop. But I was really excited about, you know, hitting hard second and third trimester. And I feel like it just gets better from here. Like, I'm so pumped to talk next week about labor and birth, and then we're going to go into postpartum and newborn care. But so when we talk about, you know, we're super excited, yay, it's the, you know, the second and third trimester. And most women love this part because they're out of the woods with any morning sickness or anything like that. So most women, they really love the second trimester because, you know, the nausea-inducing hormonal shifts at the early weeks of pregnancy have subsided. If not, I'm sorry. I do know I have clients that, you know, they're unfortunately sick throughout their whole pregnancy because their hormones are just going bonkers, but they still need support. And the third trimester, heaviness has yet to set in. So most women say that the second trimester is their favorite. And while the emotions, aches, or queasiness may present itself at any time, second trimester tends to be the most mild and likely enjoyable for most women. So this is a great time to focus on skin support and keeping your immune system healthy and strong. So here are some of our favorite recipes for soft, supple skin that is stretching well with your that stretches well with your growing belly, because your body, I mean, your skin is changing by the minute during pregnancy. You know, so there are, you know, stretch marks, tiger stripes. These may or may not be able to be avoided due to genetics, diet. And honestly, I've done research on these, and there's not, you know, direct correlations with genetics and direct correlations with diet. For me, with all three of my pregnancies, I didn't get any of those. And I think it's because I was actively, like, I was making sure that I was exfoliating regularly, and I was like just lathering myself in oils and coconut oil and making sure that my skin was like not dry and itchy and it was moisturized. And I think obviously, you know, drinking water and having a healthy diet is part of that too. So I just wanted to say we're not saying that, you know, there's one cause of it. And some women, you know, they maybe it goes away. They maybe don't get it until their second or third baby. Some only get it in the first. They don't get it in their second. So, but when we talk about, so on the screen here, we have the growing belly body butter recipe. So to make this, you can do 1 cup of shea butter. So you melt that, and you can get that like at any health food store. I feel like more and more, even, you know, like Walgreens and CVS, places like that have it now. So you melt 1 cup of shea butter with half a cup of coconut oil. So it will be liquid, and then you let it cool slightly. I've made this before. I put it in the fridge for like 10 minutes, and it kind of looks like butter. Next, you add a half cup of almond or jojoba oil. You just don't want to use anything like no vegetable oils. Then you do 10 drops of lavender and 10 drops of frankincense. And then I used a hand mixer, and you just put it in and you whip the mixture until it looks like whipped butter. And then you just store it in a glass jar with a lid on it, or in your bathroom. You rub it on your growing belly daily. You can also, we've talked a lot about the oil Gentle Baby, which we'll mention again tonight, a little bit later on. So you can also apply a few drops of Gentle Baby oil with a dab of coconut oil and apply that to your belly daily. So both recipes are amazing for skin support. They're also going to be very calming and grounding to you as you're working through your days during these trimesters.
And I am going to be making this myself, and I'm not pregnant, so it's good.
Yeah, I still make it.
Yeah.
And it's awesome. And it really keeps for a long time. It just, with the colder weather, it sometimes gets a little bit hard. But as soon as you start rubbing together, you know, it will melt right down. But yeah, it's definitely not just for pregnancy, but it's amazing for a skin support. So when we talk about libido, that's something that, you know, a lot of women, even in my classes, I bring up libido because it's something that I know pregnant women are either thinking about, having issues with, or curious about, but for some reason, nobody wants to talk about it. So with pregnancy comes increased blood flow, especially to your reproductive organs, such as your breasts, and what I sometimes like to call the lady garden. So with increased blood flow comes increased sensitivity, and for most women, that is a good thing. The second trimester is also a time where the libido hormones can change for the better. Where you may have felt too fatigued to tango in the weeks prior, you may find a new surge of sensual energy growing. This brings up the topic of sex during pregnancy. So I want to throw out a little disclaimer. While it's generally not dangerous to have sex during pregnancy, if you are high risk or tend to go into labor early or have any other risk factors, we suggest that you talk to your care provider or your midwife and ask if there are any times that you should be abstaining. Many women experience an increase in libido in their second trimester. While this is not the case for everyone, this is also the trimester where you are least likely to have a list of turnoffs. The first trimester, you may feel unwell and nauseous, and the third trimester, you may get a little achy, or you feel kind of fluffy, or your legs hurt, or you're just flat out tired. You may have to get creative to work around that basketball-sized belly, the larger that it gets. So second trimester intimacy can be extremely spontaneous and freeing. Just think, if you were trying to conceive, you no longer have to think about charting and sampling cervical mucus or pregnancy tests. You have freedom. If you weren't trying to get pregnant, then, well, you can't get more pregnant at this point, so you may as well enjoy the spontaneity that comes from jumping between the sheets without checking for condoms, pills, patches, rings, any of those things. I really think it's such a sweet and precious time to connect with your partner in this way, and it only lasts for a few months, so take advantage of it.
And the other thing too is, if this is your first baby, you'll never have another alone night. Chances are for a long time.
Yeah.
So enjoy it while you can.
Sometimes I look back and I'm like, man, you know, because then once you have one.
Yeah. Yeah, for sure. So the other thing too is, you know, for some couples, they still like to use some of those things during their during sexual intercourse that they used before for lubrication. And you guys, some of that stuff is so toxic. I mean, most of that stuff is so toxic. Please avoid that. You know, the most important time to avoid those chemical concoctions up what we call our indoor water slide is during pregnancy. You have to avoid those. I know a lot of women that used to use those. I mean, that was a problem. That's actually what caused their fertility issues. They used it in their teen years. They used all these chemical things, even spermicides or different things that they would use for lubrication. And even the condoms with all of the chemicals, lubrication, that can cause, again, it's a chemical exposure. You've got to keep them out of this area for sure and do things more natural. So that's what we're going to share with you guys tonight, is some things that you can make up for those times of intimacy. These come from the book that we are teaching from tonight called, what's the name of the book? I just lost my...
The Betsy Bosom Baby
Yes.
Book.
The Betsy Bosom Baby Book, and it's a spinoff of the Lucy Libido book. If you don't know those two books, you're going to want to get those. They are amazing resources. So oils that support libido, such as ylang ylang, orange, joy, which is a blend of essential oils. It smells amazing. Valor, cypress, another blend that's called sensation. These all can be used in moderation to make homemade lotions and lubes. So joy and sensation, though, I will point out that it has a small amount of jasmine in there. So jasmine is one of those oils that most of the time we say avoid on the uterus during your, first through 8 months of pregnancy, because it can cause some uterine contractions. So we want to avoid that. And you'll hear a lot about that. But in joy and sensation, it is actually in a combination or blend that when you use it in a combination, you use it with a carrier oil like coconut oil to make a lube, it won't have that same effect as if you were applying straight jasmine. So you don't have to be worried about that. But I do want to let everybody know that there is some jasmine in there. Just don't put it directly over the uterus. Don't do jasmine over the uterus. You don't want to do that at all. Maybe later in the pregnancy, we'll get to some of that stuff. But small amounts of peppermint or black pepper used to typically in our lubrication oils can create a cooling and a warming sensation, which can be great on the inner thighs, but again, not over that uterus. You don't want to put any of those over that, but you can safely use things like ylang ylang, orange, cypress, valor. Those can all be used in lavender, totally safe, and you don't have to worry about any of that at all. So again, when you're making this lube, all you do is you add it with 20 drops of ylang ylang, 20 drops of cypress, 5 drops of lavender, and you add that to 25 drops of your carrier oil. So coconut oil is amazing. Jojoba oil is another good one as well. You just don't want to use any vegetable oil or any toxic, canola oil or anything like that. Please don't use any of that. Another word of a caution too, that you want to be advised to avoid anything that has clary sage in it, sage, clare essence. You want to avoid those because they do have some of that clary sage in there. And again, we don't want that to have an effect on our uterus until maybe later in the 3rd trimester. So avoid those oils during this time. What else? So you also want to stay away from oils that could help support menstruation, right? So think about those blends. Avoid things like dragon thyme. You want to avoid things like juniper, just using caution and looking at your resources. We love the reference guide through the Life Science Publishing. It's a reference guide that has trustworthy information. All you do is you look up the essential oils that are safe for pregnancy and which ones that you want to avoid. And just make sure that if you're making a potion or a lotion, that you're using the safe ones. But the recipe that you see right here is totally safe. and, you know, just go for it. The other thing too is getting the Lucy Libido, the pregnancy book, the Betsy Bosom baby book has lots of other intimacy recipes, and you can just find one that you like, and you can continue that throughout your life, really.
And in those books too, and I know we talked about this earlier in the series, but they have specific pages with like the caution oils and the ones to avoid. So if you're using those as resources, if you get them, either if you wait until our week 6, and if you win them, or if you buy them on your own, there are guides in there that, you know, there's recipes, of course, but it tells you like, avoid these oils at this part of pregnancy. And, you know, these ones are safe and why. So we are kind of just throwing out words of caution for different ones. Of course, we're not going to recommend using any that are, you know, contraindicated in pregnancy. But some of them you just have to, it might just be a matter of applying them in a different area, diluting them properly, and things like that. But those books, definitely, if you're tuning into this series, I would buy them anyway, even if you do win at the end, because you could always gift it to a friend and be an amazing baby shower gift. Or, hey, you're pregnant, here's a gift, like an awesome resource book. So
yeah,
take advantage
yeah,
of
it's
it.
awesome. I just gifted one last week. And she loved it. Now, if you have been pregnant before, you know that you're going to get Charlie horses, right? I mean, it's kind of a given. I wish I had essential oils during this time. Man, it would have helped sleep so much. But you got to prepare for this, because you got to have a plan when this happens. Aromas Ease is an amazing blend that you've got to put on your next order so that you have them not only, you know, during pregnancy, but it can help at any time with muscle cramps. But most of the time when we have muscle cramps during pregnancy, it can be due to just a dip in our magnesium levels. And it's very simple to just take some natural calm magnesium or increasing your magnesium supplements. Young Living has some supplements as well, but always look into some magnesium and do your research around that. That could be a deficiency that you have going on. If you are somebody that is skittish, like you get scared very easily, or, you know, you're just one of those people that you can just whisper to and they get scared, chances are you've already got a magnesium deficiency. And so you might want to plan for that as well. Or maybe you're one of those people that the small noises, like when somebody's chewing by you, or, you know, those little small annoyances that you're like, oh my gosh, why are you breathing so loud, right? It's like that can be actually a sign of magnesium deficiencies as well. So prevent some of that and look into it. But Aromas Ease is a blend, and it's really great for just applying it right to the legs when they're tensed or cramped. And I can tell you that I have had moms that the minute that it cramped up and it woke them up in the middle of the night, they grabbed their Aromas Ease, and within 5 seconds, that cramping has stopped. You can apply that with coconut oil. You can rub it on your legs, your feet. Put your feet up if you get a Charlie horse, or, you know, have your partner stretch out and do some of that massage work as well. But grab your Aromas Ease for these times.
I wish that I would have known about Aromas Ease with my last pregnancy. I didn't really have too many Charlie horses that I remember with my first 2, but with the 3rd, oh, it was awful. And so I used another oil, or, you know, I probably lavender, maybe some peppermint, but now we always have Aromas Ease here because it works even when you're not pregnant. But that's definitely one that's on my top 5 list for when in pregnancy for sure. So I'm glad to hear some good success stories with it. So when we move into immune support, you know, you're growing a tiny human, and sometimes that little parasite just sucks up all your nutrients. And I mean, you become more compromised and susceptible to anything and everything that is going around. And I mean, that really is how the pregnant human body works. Like your body, and it's the same when you're nursing, your body is pulling from mom. The body pulls from mom to make sure that the baby is protected, growing, and all of those things, which then leaves the mom deficient. On top of that, if your system is compromised, then you're more susceptible to anything and everything that's going around. So we're going to talk about how to avoid that. one of the absolute best things that you can do besides drinking your daily Ningxia Red, which for anybody that outside of this or that's listening that knows Robin and I, Ningxia is great for all of the things, but it's like amazing superfood for pregnancy. So that would be, I guess, the best thing you could do, drinking your Ningxia Red daily. But on top of that, another awesome thing that you can do is use Thieves Essential Oil and Thieves Vitality Essential Oil on and in your body daily. So the way that you can do that is add a drop of Thieves Vitality to your daily Ningxia shot. We always try to do that in the morning because then I know that I don't have to remember later to take it. It actually like makes the Ningxia just a little bit more zingy because it has the cinnamon in it. You just put a drop right in your 2-ounce shot of Ningxia, take it, and you're done. You can do that more than one time a day, but this way you know you're at least getting 1 or 2 drops in the morning. Another great thing that you can do is make your own roller bottle of Thieves. So you want to do 10 plus drops of Thieves essential oil and then fill with the carrier oil. Or better yet, now Young Living has the pre-made Thieves roll-on. And those are great because it's already pre-diluted. You take it out, you just roll it right on. You don't have to mess with any carriers. You don't have to mess with your own supplies. This is something that, like, I'm a mom of 3. I have a diaper bag with a billion things. So I always keep one in the diaper bag. I keep one in the car, and then I have one in the house, and we use them all the time. So at this point, when you're really focusing on your immune system, Ningxia is, that's your foundation for nutrition. And then when you use these Thieves rollers, whether you make your own or you buy the Thieves roll-on from Young Living, swipe it on the back of your neck day and night, or the bottoms of your feet in the morning before you put socks on, and then at night before you go to bed. And it's really going to work to support your body against fighting off all the things that are trying to bombard you.
Excuse me. Yeah. And, another thing too is keep in mind, we are both married to chiropractors, and the best thing that you can also do for your immune system is to get adjusted. It's like rebooting that computer. So it's really important to keep up your immune system throughout pregnancy, but it's also very important to keep up your nervous system through pregnancy, and finding a qualified chiropractor that is certified to be able to adjust pregnant women is really, really important. Another thing that women can deal with is urinary tract infections, or problems with the urinary tract health, and that's because of all the hormone shifts that are going on and happening. And of course, you've got this thing growing in your belly, right? That's putting all this pressure and extra weight on your kidneys, your ureters, your bladder, and your urethra. So your bladder maybe is not emptying as well as it should. And so you can start to have some of those symptoms of burning. We all kind of know what those symptoms of urinary tract infections are, but the cloudy urine, the strong smelling urine, constant urge to go. And, to prevent some of this is, again, keeping your immune system strong, but keeping that bladder empty as frequently as possible. And especially after intercourse, you want to be getting up and emptying that bladder, so that you want to make sure that you're keeping your urinary tract area very, very clean. And drinking apple cider vinegar is very safe and effective during pregnancy, and it can really help support the urinary tract health. You can also put, some people don't like the taste of apple cider vinegar. To hide that, you can add, a tablespoon or a teaspoon of raw honey. I love Manuka honey. It's also really great to support the immune system. And another 2 oils that are great in this situation is Melrose and Purification. Those are awesome to be able to support your urinary tract and keep it healthy as well. So all you have to do is take 1 or 2 drops of Purification or Melrose, dilute it, and just apply it over your abdomen 2 to 3 times a day. Again, taking your Ningxia Red and getting adjusted can really help to prevent and support, anything that goes on with that urinary tract.
Definitely. I'm glad that you added in chiropractic, because that's, as a chiropractic family, like, that's of course always our first go-to and something that we just work in. And so, sometimes I forget to mention it because it's just so, right. I'm so blessed that it's so routine for us, and it's just at the top of our list. So I'm glad that you remember to actually say that. And obviously chiropractic is, most people think of it like, your discomfort, your belly hurts, your round ligaments hurt, your back is sore with pregnancy. And yes, it can relieve that, but it's doing so much more for the body, especially in pregnancy, but outside of that too.
Yeah.
So when we move into the third trimester, during the third trimester is when you are just ready to birth that baby. And one of the most common experiences is swelling, marshmallow, puffy legs.
I have that.
Yes. And so your body, it's carrying extra baby weight. It's working overtime to get that blood flowing. And you may find much needed relief in putting up your feet to rest, which is usually really hard for us. I feel like, even now when I'm, running around with all three of my kids, and sometimes only time that I sit down and rest and I don't even realize it is when my daughter wants to nurse. And sometimes I'm like, oh, I'm trying to do a million things, but really it feels so good to just sit down and rest. And oftentimes I feel like we ignore those signs of our body. So when you are getting those swollen marshmallow legs, definitely take that as a sign that you need to put your feet up to rest. And this was something new to me that I thought was so cool. So lemon, grapefruit, tangerine, cypress, and lemongrass oils all support healthy circulation, which I did know. And they can be added to a carrier oil, but I never connected that you could rub them, on your legs and feet for a relaxing foot rub. And it can really help to increase the circulation and potentially support, and help with that swelling that's going on in your legs. And regular chiropractic care can drastically reduce common aches and pains, as I said before. And as Robin said, make sure that you seek care from a prenatal certified chiropractor or somebody who's certified in the Webster technique. You can also do some pregnancy stretches to loosen things up. Look for a local prenatal yoga class. This is a great way to help your body adjust to this temporary discomfort. And then you can also try a few drops of Copaiba and Aromas Ease in a carrier oil and rub that onto your belly, your back, your legs, or whatever is ailing you. These oils promote healthy muscles and can relieve the temporary aches and pains. And a lot of the oils that we've mentioned are part of the starter kit, which is great. And some of them, if you're new on this, you may not have heard of, but you can, Aromas Ease has been mentioned a couple times. Cypress has been mentioned a few times. So I hope you're taking notes.
So another thing that comes up in third trimester is that GBS. And what that is group B streptococcus. And what this is, it's a test that they usually do in third trimester. They test mom to see if she's carrying this bacteria that can cause illness in people of all ages, but it's specifically dangerous to newborns. So GBS lives in the intestines, but it can travel down to the rectum, vagina, and your urinary tract. And when your water breaks, here's the problem. When your water breaks, that bacteria, if you do have that present, then in the vagina, it can travel up to the baby and into the amniotic fluid. And as we all know, sometimes babies swallow the amniotic fluid during birth. And if it has this bacteria in there, it can be a problem. So worldwide, about 10 to 30% of pregnant women are found to have GBS in their bodies. I was one of them. Again, so between 35 and 37 weeks, your provider will test for this. And if the test comes back positive, don't be scared. This can be, something that is there. But if it comes back positive, your provider is going to recommend then that IV antibiotics be given during labor to prevent this bacteria from transferring to your baby. Now, I do know that some people have refused the antibiotics. That's something that you have to look into yourself. But what the medical model says is there's really no cure or treatment for GBS. But things you can do, again, is to really work hard on supporting your immune system regularly. Cut out sugar. So if you have this come back positive, what you can do is immediately cut out sugar and all your junk food from your diet, reduce your stress levels, eat fermented foods, so kombucha, some other things that look up all the things fermented and eat a bunch of that. You're looking to add good bacteria. So you need those probiotics. And again, it's one of those things that's foundational that we talked about, that you want probiotics through your entire pregnancy, but maybe you really need some additional support during this time to keep that bacteria, the good bacteria. So we all have good bacteria, and the GBS is a bad bacteria that we don't want. And so the good bacteria in our bodies can fight this up. So having your probiotics is an excellent way to really give your body the best chance to get over this within safely. So support your immune system by also taking your Ningxia Red, taking your Super C chewables if this comes up. And then right before, typically what they'll do is they just say, oh, you were tested once positive and we're just going to do antibiotics. But be your own health advocate. Maybe say, hey, I'm going to work on these things. I'm going to cut my sugar out. And then could you run a test again before I give birth? See what happens. See if you're at risk. The other thing too is if you're going to have a C-section, well, it's not going to go down the birth canal anyways. So, just talk to your provider about different options. If IV antibiotics is not something that you want for your birth plan, just, talk and be open with your provider and see what other options that are there for you. But don't be scared about it. It is something to use precaution and do some things about, but I've not had anybody that I've known have detrimental effects from something like that. But it can happen, and that's why they take it very seriously.
Definitely. That's, as a birth educator, I see, I've had families come that, they're already planning to have a repeat cesarean, or on the opposite side, people that don't want any intervention at all and want to have, they're planning a home birth with a midwife and all these things. And that's definitely something that it's a real thing, but it's kind of touchy based on, who your provider is and what their viewpoint is. So definitely good touching points on that. So we've talked about Gentle Baby, and we will mention it probably in the next 3 series because it applies throughout. I mean, even now I'm not pregnant, but I have little kids. I use it on myself. We diffuse this regularly. I use it on the kids, before bed. So the Gentle Baby oil, which is one of our giveaways also at the end of the series, you can combine it with coconut oil, and moms can actually put this on their chest before nursing. It's going to help with bonding. You can rub it on the mom's tummy to support healthy skin, which we talked about. Myself, I love doing this. I just put 1 drop on my hands, rub it together, and inhale. It's just very like a peaceful and calming blend. We're going to talk about when we get into infant care, it's the toxin thing is definitely going to come back up. You want to make sure that you're, not using toxic products with your baby. You can make your own baby lotion using coconut oil and Gentle Baby oil. You can diffuse it at bedtimes for kids of all ages. My kids love this oil. And if you choose to bring a diffuser to the hospital, or if you have your diffuser going at home, if you have a home birth, you can do that. It can really help to support and calm emotions during birth. That was totally my plan with my 3rd baby. And it was so fast that I think the bottle was on the counter. And later my husband's like, what was I supposed to do with that? And we definitely planned to put it in the diffuser. But, after he was born, I put it on with some coconut oil, rubbed it on my shoulders, had him rub it on my back. And I really felt it like it just kind of like cradled me right in and around my birth and in the immediate postpartum. So if you are a Young Living member, get Gentle Baby. If you are not a Young Living member, you should still figure out how to get Gentle Baby. And we will, like I said, we'll be giving one away at the end of this series.
Put it on your registry.
Yes. So when we're talking about using oils and taking products, it all boils down to knowing your body, which we've touched on before. But we're going to talk about some tips and health practices for you to use during pregnancy to help you feel amazing, all the way through D-Day and beyond. You can start doing any of these at any time, but I always say the earlier the better. Alignment. So we've mentioned chiropractic quite a few times, which isn't a surprise. We're both chiropractic wives. But when we talk about alignment, your body goes through so many changes while pregnant. Your growing baby is pushing on your organs. Your own ligaments are stretching. Your hormones are causing your cartilage to loosen up as it prepares your body to give birth, to your baby. Although aches and pains can be described as normal, they're more accurately described as common. And you can help avoid discomfort by taking care of yourself and listening to your body so that you can stay physically comfortable all the way through to delivery and beyond. One of my personal physical complaints now, as my oldest is 7, I'm a mom of 3, is, you know, my lower back is always hurting. And my husband is a chiropractor. He says it's because of the posture when I'm nursing and when I'm, you know, sleeping and laying with the kids and stuff. And I know in my heart that if I didn't have Young Living to support me and put on oils and just be taking care of my body the best that I can, these little, you know, these little whimpers of pain that I experience in my low back would be probably unbearable if I wasn't supporting them in a non-toxic way. So here are some things that you can do during pregnancy to help with alignment. You can rub Valor oil daily on your hips and spine and along the inside of each foot. This oil is an amazing blend. This was actually one of my first oils from Young Living that kind of made me a believer. And this oil is known as the chiropractor in a bottle. It does not replace chiropractic, but it definitely can work on really just centering everything and really supporting that. After we all get adjusted, we rub Valor on everybody's spine. It really helps with that. You should make weekly chiropractor visits. You can apply Valor before your visit or after. If your baby happens to be breech or malpositioned, this includes posterior, transverse, and breech is the most common. Find a chiropractor who is certified in the Webster technique. This technique, so there are a couple of techniques to essentially turn babies, but some of them are very dangerous because they are manually turning the baby, whereas Webster technique, the chiropractors work with certain trigger points to loosen the round ligaments and allow the baby to turn on its own. And I feel like that's really important to share because I don't personally recommend my clients to go and have their baby manually turned. Sometimes there is a physical limitation, like a short cord or something, maybe a placenta, the way the placenta is positioned, and maybe the baby physically cannot turn. And if you force that manually, it could cause other issues. Whereas the Webster technique moves things out of the way so that the baby can turn in their own time and on their own. So I just wanted to put that out there. Another great thing that you can do is to sleep with a wedge pillow, a pregnancy pillow, or even just a big body pillow under your knees and around between your knees and under your belly. You can even use these pillows postpartum as well. And now they have like so many different unique pillows for, you know, like a giant pillow that hugs your whole body for pregnancy that's, you know, like 8 feet long. I went to Target and bought a $10 body pillow that worked great for me. And then I used other like every pillow in the house I was kind of surrounding myself with.
Yeah, it's all about the pillows.
So it's definitely
pillows everywhere.
Yes. And you know, those, even just that little bit of pressure can really help. That little bit of support, can help to take a lot of pressure off the joints. We have talked about this before, and we're going to talk about it again. So nutrition and daily support. So when you're pregnant, you are eating for 2. You want to go for quality, not quantity, because, you know, even when you're not pregnant, if you eat a well-rounded meal, you feel great. Your digestion is good. You don't have brain fog. If you eat 6 pizzas, you feel like a giant blob. You're full. You can't move and you feel awful. It's, I mean, the same with, I feel like goes without saying, but you want to go for quality, not quantity. So did you know that if you are a healthy weight, you don't really need any additional calories in the first trimester? You do need additional calories throughout pregnancy, but in the first trimester, you know, people all of a sudden think they're pregnant, they're eating for 2, and they have to double everything they're eating. That is when some people run into trouble and they find themselves like, oh, you know, everybody gains weight on a different timeline in pregnancy, but in the first trimester, you really don't need that much extra. You just eat when you want to eat, fill your body with healthy foods. In your second trimester, you only need about 340 to 400 calories a day. By your third trimester, you need an extra 450 to 500 calories a day. During pregnancy, your body is pulling vitamins and minerals from you to give to your baby. And that is why it's important for you to replenish those vitamins and minerals in your body with healthy food and supplements. Whole food supplements, nothing synthetic, are a great way to help support your body, and therefore your baby gets the nutrients that you both need. So here are some of the nutritional supplements that Young Living has to offer. Ningxia Red is filled with antioxidants. It also has all of it's just a superfood. It has the equivalent of, I have the exact calculations here. So it says it's the equivalent of 100 oranges, 814 blueberries, 22 carrots, 10 pounds of spinach, 59 broccoli florets, 73 strawberries, and 93 apples is in 1 ounce of Ningxia. Nobody is going to eat that. Nobody could eat that in one sitting. So Ningxia Red is definitely a great foundational support. It helps to maintain healthy blood glucose levels, provide extra nutrients your body needs, keeps your energy level up. Morning sickness can often happen because of irregular blood sugar levels. So don't skip your Ningxia. If you start to get, one of those, like a fatigue or crash in the afternoon, take a shot, 1 or 2 ounces of Ningxia, and you'll really notice that it's going to provide your body with the nutrients to help keep your energy levels up without, worrying about a caffeine crash later or being kept awake all night because you chose to have caffeine. The Life 9 probiotic. So this high potency probiotic combines 17 billion live cultures from 9 beneficial bacteria strains to promote healthy digestion, support a healthy gut, and maintain normal intestinal flora. Like Robin said, this supplement, the Life 9, is also going to be huge with keeping your vaginal bacteria and your birth canal loaded with good bacteria. A healthy gut also keeps our immune system strong. It allows us to absorb the proper nutrients, and it keeps things flowing regularly when we have that little one growing inside of us and pushing everything around. So there's daily oils. Young Living also has a dietary line of oils called the Vitality line. So ingesting a drop or 2 of both these Vitality and Lemon Vitality, you can mix this with your Ningxia Red, you can mix this with your favorite tea, or even just water, can help to support the immune system throughout pregnancy. This can be especially helpful if you struggle with your daily water intake. Adding a drop of lemon or peppermint Vitality or grapefruit Vitality or tangerine Vitality into your water can give it a little flavor, and that might be the extra incentive that you need to get the quantity of water that you need each day. Now, with daily supplements, you can take whatever supplements your doctor, midwife, or chiropractor suggests to support your immune system and keep you energized and healthy. This is likely going to include a prenatal vitamin, vitamin D. You want to make sure that any supplements that you're taking have natural folate, not folic acid. You can take a folate supplement like Organ FA, which is found in Young Living's Super B complex. What's called Super B, it's a complex of Super B vitamins. Make sure that you're getting enough calcium and magnesium can also be very helpful. These little tidbits right here about natural folate, Super B's, calcium, magnesium is so important for those who have the MTHFR genetic mutation that we mentioned in our first class. And we really want you guys to feel empowered to make your own health choices. Don't be afraid to mention to your provider, hey, I was looking into this supplement. I think I'm going to be taking that. And just making your own health choices. And honestly, I know some women who said, they mentioned something that was not exactly what the doctor wanted, and the doctor said, you should probably avoid that. Well, they did their own research and found out it was better than anything else out there. And, they took charge of their own health choices, and it was the best thing for them. If you plan to breastfeed and are nervous about milk production, some women choose to discontinue the regular use of peppermint a month-ish before your due date, meaning maybe don't put peppermint in your water every single day. Some women are sensitive to mint and have reported decreased milk production when using it regularly while nursing. I'm not saying you have to avoid mint all around, but maybe avoid taking peppermint in your water daily. You can use it for other things here and there, but you just want to limit that. If that's something that you are worried about, some women are not affected by peppermint at all.
Yep. I know that my sister was pretty sensitive to that too. And then, there's some women that, like you said, not at all. And then even when somebody wants to start weaning off, they might use a little bit more peppermint.
Definitely. Yep.
For that reason too. So as we conclude here, again, most of you are already a Young Living member. You know exactly how to get these oils. But for those of you who are not, how you get these into your hands and quickly is you become a wholesale member by purchasing a premium starter kit. And those are the oils that we've been talking about throughout this entire series. And again, it comes with 11 essential oils that we feel are the most important to have as your foundational oils. And it comes with a premium starter kit, comes with the Ningxia Red samples, the Thieves household cleaning sample, 11 everyday oils, and your diffuser. If you want to get started with that, I reach out to the person that invited you to this class, or we will be posting our links in the comment section of the event page. Also below this video, you will find the link to get started with your premium starter kit as well. So again, your premium starter kit comes with a no strings attached membership. You'll be able to purchase Young Living products at 24% off, kind of like a Costco membership. And you get to join then Essential Rewards as a choice. And Essential Rewards, how you can then start getting all of these wish lists in your monthly subscription box. The monthly subscription boxes are all the hype right now. I get several of them. I get some of my juicing that way. I get all kinds of other things that way as well. But it's a great way to customize your monthly wish list and get it delivered straight to your door. You can earn money back for that. You can also earn lots of free products that way. And again, helping others to get these products in their life too can add cash to your pocket. And who doesn't need some cash, extra cash in their pocket as they stay home and take care of their newborn? So if you're interested in the business end of it, we would love to have you a part of our team. Just reach out to us and we will talk to you about how to get started that way. Again, whoever introduced you to this presentation cares about you and feels that you can value all of this great information. And I am so excited for you guys to get started. If you haven't already, we again are the Vibrant Drops team, and we have a team of over 1,500, and we have a closed Facebook group. We have lots of education that we pour into you. We send you some great welcome gifts. Super excited for you guys to get started with our team, and be careful. You know, again, if you're just out there and you're just going on Young Living and you're not attached to a certain team, you might be left as what we call an orphan out there and not being taken care of with all this great education and support. So make sure that you get with our Vibrant Drops team, and so that we can love on you and we can support you as best we do. Again, as we talk about the benefits of having a Young Living account, mamas don't let mamas join Young Living or reorder without telling them about that Essential Rewards program that I just mentioned. It's the one thing that I'm telling you, as many people that I have helped get a membership with Young Living, there's the one thing that our members say they wish they had known about earlier. So again, it's that monthly customizable subscription box. This is the best way to save money with all of your oil arsenals, replace all those chemicals, harmful chemical products in your home, and start getting all of these beauty products and must-haves for your new baby through the Essential Rewards program. What this is, you get 10 to 25% back in Essential Reward points every time you order, and you use points instead of paying for products as that builds up. You get free loyalty gifts at months 3, 6, 9, and 12 just for being an Essential Rewards member. Again, this is not required with your Young Living membership, but it is an amazing, amazing program that if you're not a part of it, you are missing out. Access to discounted Essential Reward kits like the Ningxia Red and the Thieves Household ER, what we call Essential Rewards stands, we call that ER. Their Thieves ER kit, you also get all those promotional items that Young Living just loves to share with us every single month. So we also have now the ability to get free shipping with this program. Just like in Amazon Prime, you pay the one fee during your sign-up process. You pay that one fee per year, and then you can get your shipping for free. It's called the YL Go and the YL Go Plus programs. If you're not a part of that and you are an existing member on ER, oh my gosh, as we stop, go do that right now because you're missing out on free shipping. So again, we want to just thank you guys so much for joining us for the second and third trimester. And next week, Tuesday, we will be sharing with you all about D-Day and what's to come with that. So if you guys know of somebody that needs to be on this call, invite them. And again, we are doing these amazing books and this oil as a giveaway for everybody that's participated. We thank you guys so much. If you have any questions, just reach out to us or comment below and we will answer all of your questions. So thanks again and have a great night.
Good night.